You feel it before you're fully awake. A sharp, deep throb in your side. Something is wrong. Your first instinct is to reach for something. A pill, a phone, a doctor. But for most of human history, there was none of that. No emergency room, no antiseptic, no painkillers. Just you, the pain, and whatever your group could figure out together. For roughly 300,000 years, this was the reality for every human being who ever lived. Pain was not a signal you could mute. Injury was not a problem you could hand off to a specialist. And yet somehow our ancestors survived. Not just survived, they thrived. They hunted dangerous animals, crossed unfamiliar terrain, gave birth in the open, and kept going after injuries that would send a modern person straight to surgery. How did they do it? The answer is stranger, more sophisticated, and more deeply human than you might expect. Start with the basics. Pain for your ancient ancestors was not the enemy. It was information. Anthropologist Paul Shepard argued that hunter-gatherer groups maintained an intimate daily relationship with physical discomfort that modern humans have almost entirely lost. You learned your body the way you learned the landscape, through constant, careful attention. A twisted ankle told you something about the terrain. A fever told you something about contamination. Pain was a teacher, not a punishment. This isn't romanticizing hardship. It's recognizing that your ancestors had no choice but to become experts in their own bodies. And that expertise was collective. When someone in the group was injured, the whole group responded. Bioarchaeologist Jane Bwickstra has spent decades analyzing ancient skeletons, and what she found upends the assumption that prehistoric life was simply brutal and short. Skeleton after skeleton shows evidence of serious injury, broken femurs, crushed vertebrae, deep blade wounds, followed by prolonged recovery. Bones that healed. And healing takes time. It takes stillness. It takes someone else doing the hunting, the carrying, the fire tending while you recover. Bwijkstra's work is a forensic record of ancient care. These people were looked after. One of the most famous examples comes from a Neanderthal burial site called Shanidar Cave in northern Iraq, excavated in the 1950s by Ralph Selecki. Among the remains was an individual, now called Shanidar I, who had survived to middle age with a withered arm, a healed crushing blow to the skull, and severe arthritis. He was, by any measure, significantly disabled. He could not have survived without the active, sustained support of others around him. Whether or not you consider Neanderthals fully human, the implication is the same. Caring for the injured and disabled is not a modern invention. It may be one of the oldest things we do, but support was only part of the picture. Your ancestors also treated injury directly, using what was available in the world around them. The pharmacopoeia of the ancient world was the forest, the riverbank, and the soil. Ethnobotanist Daniel Moorman, who compiled one of the largest databases of Native American medicinal plant use ever assembled, documented over 2,700 plant species used for healing purposes across indigenous North American cultures. The patterns that emerge are striking. Willow bark, which contains salicin, the compound that modern aspirin is synthesized from, was used across dozens of unconnected cultures on multiple continents to reduce fever and dull pain. Your ancestors discovered aspirin. They just didn't know what to call the molecule. Yarrow, a common wildflower, was used to stop bleeding by cultures from ancient Egypt to pre-Columbian America. Yarrow contains achylitin, a compound that genuinely accelerates clotting. The Greek myth that Achilles used it on his soldiers' wounds is almost certainly not just a myth. It's a record of real practice. Honey was applied to wounds across ancient cultures from Egypt to sub-Saharan Africa. We now know why it works. Honey is hygroscopic, meaning it draws moisture out of bacteria, killing them. It also releases small amounts of hydrogen peroxide as it breaks down. Ancient wound dressing, with a biochemical mechanism, modern science has confirmed. Your ancestors were not guessing, they were doing applied science with the tools they had. And then there was the knowledge of the body itself. Archaeological evidence from sites like Blombos Cave in South Africa, which shows evidence of symbolic thinking and complex behavior dating back 75,000 years, suggests that cognitive sophistication and bodily self-awareness were developing together, long before agriculture or cities. People understood that some injuries healed and some didn't. They understood the difference between a wound that was closing and one that was festering. They understood fever, delirium, the smell of infection. They made decisions, sometimes brutal ones, based on that understanding. Trepanation, one of the oldest surgical procedures ever documented, involves drilling or scraping a hole into the skull. Evidence of it appears in skulls dating back at least 7,000 years, found across Europe, South America, and the Pacific. What is extraordinary is not just that ancient people performed brain surgery. It is that many of the patients survived. You can tell because the bone shows regrowth around the opening. New bone laid down over months or years after the procedure. These were not accidental perforations. They were deliberate interventions, and they worked. So let's reconstruct a scene. You are an adult in a hunter-gatherer band somewhere in East Africa, roughly 50,000 years ago. During a hunt, you take a bad fall and your lower leg snaps. The crack is audible. The pain is immediate and total. Two other hunters get you upright and half carry you back to the camp. By the time you arrive, your role as a patient has already been assumed by the group. Someone is stripping bark from a willow tree near the waterline. Not because they understand salicin, but because generations of knowledge say the bark eases pain and swelling. Someone else is preparing a splint from two flat branches and strips of animal hide. The leg will be immobilized. You will not hunt for weeks, possibly months. Other people will carry your share of the food. A senior woman, the person in the group who has seen the most injuries, treated the most fevers, watched the most wounds close or turn, examines the break. She has seen this before. She knows a clean break heals. She knows infection is the real threat. She packs the wound with honey and covers it with a broad leaf to keep out debris. She tells you to drink broth and stay still. You are not in a hospital. You are not alone. Here's the counterintuitive part. For most of human history, serious injury did not automatically mean death. It meant dependence. And dependence in a tight-knit group activated something powerful: the social immune system. The obligation to care, the knowledge accumulated across generations, and the remarkable healing capacity of a human body given enough time and stillness. What changed is not the human body. What changed is the social structure around it. Modern medicine is extraordinary. It has extended the boundary of what injury humans can survive far beyond anything your ancestors could have imagined. But in the process, we have outsourced something ancient and intimate: the role of the group in healing. Studies by researcher Julianne Holt-Lundstad have found that social isolation is as damaging to long-term health as smoking 15 cigarettes a day. The mechanism your ancestors used to survive a broken leg, tight community, sustained care, the removal of isolation, turns out to be one of the most potent healing forces your biology knows. You have inherited a body that expects, at the cellular level, to be cared for by other people when it is broken. The next time you feel something go wrong, and you reach instinctively for another person, for a hand, a voice, a presence, that is not weakness. That is 300,000 years of survival strategy, still running in your nervous system exactly as designed. Your ancestors handled pain by refusing to handle it alone. So do you.